Hello, and welcome to the Parkinson's Foundation Wellness Wednesday. My name is Kim Nitz. I'm on the Community Programs team for the Parkinson's Foundation. Today, we are going to discuss the important topic of caregiver burnout. What a fantastic turnout we have today, and we welcome all of you. I know we say it often, but you're never alone on the Parkinson's journey. And I think just seeing everybody's geographic location today really drives that point home. So thank you all for being here. As we begin, we want to welcome you and just take a moment to share the mission of the foundation. Each day and in everything that we do, we're working to make life better for people living with Parkinson's. To achieve our mission, we focus on three primary goals: to improve care for everyone with Parkinson's, to advance research toward a cure, and to empower and educate our global community. Today's program is a great example of one of the things we are doing to meet these goals. Now, to help us get to know our audience today, we're going to take just a brief moment to answer the poll that you'll see on your screen. If you'll respond to that, we'll launch the results in just a few moments. And in the meantime, I'm going to introduce my colleague and our first speaker, Annie Brookes. Annie, you can take it from here.
Thank you so much, Kim. I am so excited to be here with you all today. My name is Annie Brookes, and I have been working with care partners through the Parkinson's Foundation for nearly 7 years now. And I am so excited to share the stage today with a care partner I've known for most of that time. I will let Marlene introduce herself shortly. But before I do that, I've got some things to walk you through. And I see we've got our poll results. The vast majority of you are the spouse or partner of someone with Parkinson's. That's not surprising, 85%. Well, welcome to all of you. I see we've got some people with Parkinson's joining as well, and a couple of other roles. All right, so I am going to real quick share my screen, and you should be seeing my slides now. All right, so Marlene, who, like I said, will be introducing herself shortly, helped as part of our Care Partner Program Planning Committee to create a new program that is now available online called our Parkinson's Foundation Care Partner Program. And this group that she's a part of, our Care Partner Program Planning Committee, is made up of current and former care partners who historically advised the foundation on our Care Partner Summit, which some of you may have participated in. In the before times, pre-COVID, this was an in-person program that brought together care partners from around the country while also offering online streaming and simultaneous viewing parties all around the world. I hope that one day soon we'll get back to that side of the program, but I'm really excited to share this new program, which is a series of self-paced online courses designed for you based on the topics that the committee felt were most important. So currently we have 8 courses available in English, in addition to a welcome course, which is where we encourage all participants to start. So if you haven't registered for this program already, which I know many of you have when I looked at who was registered for this and who was a participant of the course, you can visit parkinson.org/care-partner-program once we wrap up today to get registered, start the welcome course, and take a look around. And we'll hang on for a little while to troubleshoot any challenges you face as you're getting into the system. So with that, I will turn it over to Marlene to introduce herself. How are you today, Marlene?
Hi, I'm good. Thank you for having me here today. My name's Marlene Perdan, and I am a care partner. Just tell you a little bit about myself and my Parkinson's journey. My husband, Bill, was diagnosed with Parkinson's in 2009. So we've been doing this a little bit over 13 years. Like a lot of you, it took about 2 years, 1.5 years, 2 years to get a diagnosis. So we've probably been doing it a little bit longer than that. after my husband was diagnosed, his father was diagnosed with Parkinson's. And 2 years ago, my father-in-law passed away from complications. And then last year, my older sister was diagnosed with Parkinson's. And we also have, my husband has another extended family member with Parkinson's. So Bill was the first of the family members to get it. And then slowly other people started getting it too. So we've really we've experienced quite a bit over the last, I'd say 15 years. And so that's where my journey started, and we're still journeying on. Bill's progression, when Bill first got diagnosed, he was working, he was an accountant, he was working full time. And for the first 3 years, he worked for 6 years, but for the first 3 years, things really chugged along like normal. He got on meds, he started exercising, the Parkinson's exercising classes, and really wasn't even telling many people he had Parkinson's. So things didn't really change. And then about year 3, which I hear from a lot of people that happens, things really changed. And he worked for 3 more years, but full time, but it was probably too many. And so during that time, everything for us, and from a lot of people that I talk to, because I know over the years I've met a lot of people who are dealing with Parkinson's, and things just change gradually. It seems like all of a sudden overnight, but it's not. It's this gradual. He was working full time, and then he had to go on disability, and then he he was driving more, and then he still drives, but he can't drive very long distances. And so little bit by little bit, my load started getting heavier, and you don't even really notice it because you're helping. He was taking care of all his meds, and then it became he couldn't keep up with the meds. And so then I was taking care of meds, and now I'm driving most of the time. And he still moves pretty well, and he's still, one day he started having, I say one day, but it just happened, seems like one day, started having mild cognitive impairment and issues with low blood pressure, the neurostatic, I think it's hypotension. And, so little bit by little bit, I started taking things over. One day, he was an accountant, so he took care of all of the finances. And then we realized things were getting messed up with the bank statements. And so now I'm the resident financial person. And then I just found myself going, I don't want to be the handyman person around my house. I got that job too now. So the load gets so heavy and you don't realize it, And so I think that's like one of the things I'm learning over time is to pay attention to, you can't do it all because it's progressive disease, and as things go, and everyone's different because everyone doesn't get the same symptoms. But for Bill, the cognitive issues started kicking in, and we were just floored at that. And when that started happening, things changed a lot. And he's doing good, but at the same time, he can't do the things he used to. So I think, letting yourself see the changes that are happening. I didn't really even realize I was burnt out. My daughter told me I was burnt out. She said, this is true, the day before Annie asked me to do this, she said, Mom, you're so burnt out. And I asked her, I talked to Annie and I asked her, Annie said, why did she say that? So I asked her and she said, because you were saying things like, I know I shouldn't get so frustrated with him right away. And I want to change that, but I don't know how. Or I know I'm taking on too much and I need help, but I just don't know what to do. And it was like, that whole idea that you're doing too much, it's too much, you're getting, your fuse is short and you're getting frustrated, but you don't know what to do about it. So you just keep doing it. You just keep working that job and taking on that load. And so that's why she said, Mom, needing to get, more help. And so anyway, that's where we are.
Thanks, Marlene. We're gonna have a really great conversation about the things that you've done well, the things that you've learned along the way. But before we do that, I really want to make sure that we're all starting from the same place and sort of having the same conversation. So I'm going to share my screen again and walk you guys through some of the concepts that we're going to be talking about. So when I think about the stress that caregivers experience as part of their role, I like to think of it on a continuum. So today I'm sharing with you this concept of the caregiver burden continuum. A recent literature review defined caregiver burden as a complex, multidimensional concept that includes factors that are both subjective, meaning they're based on your own personal experience, and objective, meaning they're not really influenced by feelings and they're a little easier to measure. So when we look at this, here on the front end, we have caregiver stress that we expect all care partners to experience. You'll see the word manageable in quotes because no one gets to decide what is manageable except each individual care partner. And what is manageable will change over time. The review I mentioned identified 3 key experiences that typically play a role in how caregiver burden grows and changes. I lost track of my mouse. There we go. So the first is insufficient financial resources. And then we have a lack of social activities or social isolation. And then finally, multiple responsibility conflicts, meaning you're struggling to fulfill all of your roles simultaneously. So if you can't be there for your loved one with Parkinson's as much as you want to because you're taking on other things you have at work, or your role as a parent, or you're caring for, an additional person with another condition. All of this plays into moving from that manageable caregiver stress into caregiver strain. So when that manageable amount of stress and anxiety grows to be a little less manageable, we start calling it caregiver strain. And you will know that you've hit the caregiver strain stage when the stress and anxiety begin to impact your ability to care for your loved one. According to the Modified Caregiver Strain Index, caregiver strain is defined as the perception of persistent problems and feeling a decreased well-being that results from providing prolonged care. And then, if caregiver strain is not addressed, it progresses into caregiver burnout. The Cleveland Clinic defines caregiver burnout as a state of physical, emotional, and mental exhaustion, which may be accompanied by a change in attitude from positive and caring to negative and unconcerned. Burnout can occur when caregivers don't get the help they need, or if they try to do more than they're able to, either physically or financially. It can be hard to recognize when you're burnt out or experiencing strain that is moving towards burnout. So next I'm going to share a clip with you from our Care Partner Program course, What is Caregiver Burnout? And we'll hear from an expert Parkinson's social worker, Lance Wilson, highlighting what this might look like in your life.
So caregiver burnout can show up a few different ways. So I think the easiest or the most noted way is fatigue, but also frustration, anger, withdrawal. And even with that, there's some physical and psychosocial symptoms that might come out of that. So, those aches and pains that, have been bothering, that won't go away, that might have something to do with that stress you're carrying around. Or those some of those cognitive things. You can't remember why you walked into the room, and sometimes it's not always age related. Sometimes it's because you're carrying too much of a load on your mental. So that's how it can appear or show up.
So maybe you're starting to realize that this concept of caregiver burnout is more relevant to you than you initially thought. I'm going to show you one more clip from the burnout course. that talks about what to do if that's the case for you. And then we're going to get into our conversation with Marlene.
So if caregiver strain starts to progress to burnout, the first thing is to name it, because we can't do anything if we don't call it what it is. And that, if the care partner is not willing to say, hey, I'm overwhelmed, or hey, I think this is becoming a bit much, then there's not many interventions that can be done. So once they name it, then we can start talking about what self-care looks like and what might be realistic for that care partner to participate in self-care in a safe way that the person or the patient with Parkinson's is still being tended to, but that person is still able to participate in what they need to kind of replenish.
All right. So if it feels okay to do so right now, I want to encourage each of you to type into the chat whether you're feeling like you're experiencing caregiver stress, caregiver strain, or caregiver burnout, or even if you're not sure, because we all feel more supported when we see that we're not alone in our experience. Awesome. I love seeing your chats come in. Lots of folks who are somewhere in between. I see a lot of caregiver sadness. I hear a lot about that. Well, with that, Marlene, I'd love to invite you to join me again on screen and we can get into it. All right, so Marlene, we've talked a lot together about some of the things that you've done that have worked well. So what are some strategies that you have used or are currently using to take care of yourself and either prevent burnout or address it?
So one of the biggest things, about 3 years ago, I was diagnosed with rheumatoid arthritis, and that was a little bit of a wake-up call to make sure that I take care of myself. So I get to all the doctor's appointments I need to get to, and I get the medications I need. So it's kind of like, that's the one thing we do, sort of like Bill and I have equal, we get Bill's doctor's appointments and his prescriptions, and then there's Marlene's. And so that's the one thing. It's really hard because most care partners are always second. And I really try to keep that even. We try to eat really well. And one of the things that's hard, but we try. And one of the things that doing trying to get back into like a mindfulness meditation practice. It's like I do it for a while and it's really good, and then things come up and you drop it, and but that it's really good to get back into it. And like I know the foundation has like the Mindfulness Mondays, and I've done some of the courses, and there was one where they took you through some meditation. And it's really good. It doesn't have to be a lot. I'm trying to get up. If I can get up just a little bit earlier than Bill does and get that time to just quiet, it really adds a lot to my patience level, because that's the biggest thing. Everyone says patience, there's no, your patience wears so thin. I think I was telling Annie, I get up with all these high hopes and my patience lasts about 4 minutes. I'm trying, and we all are, but that quiet alone time, whether you pray, meditate, whatever it is you do, it really does help. It helps me. And just like I love coffee, so even just a cup of coffee. I think was telling them that people talk about having like days off and time off, and that's really important, but I think for me, especially if you can get it more often, even if it's in little chunks, 15 minutes, it seems like during the course of a day, that actually helps me, like taking that little break that you would get if you had a job, what you do. And everyone's different, but that really helps me.
Awesome. Yeah, I think it's really important to think about both the big and the little things that you can do, the things you can do a couple times throughout the year where you're really carving out a lot of time for yourself, as well as those things you can sprinkle in throughout the day, like a nice cup of coffee or lighting a candle or making that time for mindfulness. What can you share with the other care partners who are with us today about what ultimately helped you practice self-care and identify and address burnout?
I think for me, I noticed that, my daughter telling me that I needed to, listening to what other people are saying. Also, although sometimes our family and friends don't always notice what's going on, but being honest with yourself, and then just noticing like my fuse was short. I just couldn't, I didn't have the patience. And then I noticed like I stopped wanting to do things like because they were hard. So, I mean, like, well, I know this doesn't sound, I live sort of far out. I'm in Ohio. So I'm a little out of the city. And so it would be like, I don't want to drive 35 minutes to go to a restaurant. And I was really limiting ourselves from doing things because I was tired and I was worn out. And like, well, then I'm going to have to do this for Bill and that for Bill. And I don't want to do that. And so I was noticing that, I was just kind of limiting. And sometimes limiting is okay to say it's too much, but I was doing it a little too much. And so I noticed that. And I noticed that if I, I was thinking about this, the resentment was setting in. Bill, I was trying to get Bill settled, and I'd be like, okay, you go on the exercise bike, and then I would empty the dishwasher. Okay, you go paint, and I would do laundry. Okay, you go and out to lunch with a friend, and I'll pay bills. And I'm thinking, why am I doing that? Like I have, sometimes you need that alone time to focus, but I should take at least one of those and go read a book, go out to lunch, go do something fun. So I was doing it, I was taking the load on and on. So I started just telling people, letting them in, we're afraid to let everybody know, maybe we're not doing as great as we think we are, and or they think you are. If I just let them in a little bit, then you start talking about it, then they start coming up with ideas. Hey, can I take Bill to lunch? And it'd be like, yes, take Bill to lunch, because that's a great way. I know he's okay. I have a couple of hours. Someone asked me what he can do at Christmas. I said, Bill likes to put up trains, and can you help him with, putting up a train, because he couldn't do it anymore. And they did, they came, and then they put up our tree. And I was like, yay. I mean, it just kind of, it doesn't have to be the big things that we think they are, but then you can ask people for help, for doctors, rides to the doctor, whatever you need. But I think it's just that realizing, I think that was that wake up that he was, because I said, you get to do all this stuff and I'm working. And I'm like, why am I doing that? So I think we do that to ourselves, and just trying to find a way to ease the load a little bit.
Yeah, it sounds like you are getting better at the practice of seeking out support. Who do you look to in your life for that support?
Well, I have some key people that I talk to. My daughter, for one, she's 35, and then I have, sister and sister-in-law, neighbors. We have a church group, certain people that, like I said, as they get to know us and they know Bill, they just start, noticing things, and then they become like, well, when he starts going to lunch, I mean, with the pandemic, it was hard, but now people are taking him to lunch maybe once a week. Someone takes him, not the same people. I mean, they just go somewhere, but it's such a great, it makes him happy, makes me happy. And so I think it was, it doesn't always have to be family, like some of the neighbors, even things like our neighbor takes out our garbage for us, or like I said, the little things. And as we talk about it and share, and the other thing is, as Bill progresses, his symptoms become more obvious. And so then people start to actually will approach me more. In the beginning, you know, when people don't know, that's why, you know, it's hard because it's hard to know when to let people in, but really don't try to do it alone, because this is like been a while now, and we've gone through this whole, you know, sometimes you're chugging along and you're doing great, and then Bill had a DBS put in, and then it had to come out, and so it's been a journey.
Awesome. All right. So before we dive into Q&A, I've got a couple things I want to share with the group around tools and resources. But before I do that, is there anything else you think you want to share with the group, Marlene?
No, I think that's good. I just really just give yourself, you know, like I said, more breaks. And if you start, you can find them. Don't try to take it all on, because we do. And it's hard. But, you know, there's people that want to help you. And the foundation, things like this have been really, I just thought about it when I was working full time. I remember doing one of these at lunch at my job. So
love it. All right. So, all right, let me find my notes. All right. So I want to share some different resources with you. First, and I think we'll put a link in the chat for this Caregiver SelfAssessment that is up on the screen. So this was originally developed and tested by the American Medical Association, and we are offering it as an anonymous survey that will automatically calculate your results. So we'll get to see the anonymized data, but we won't see who submitted what. And you'll end up getting some indication of where you are on that continuum, how significant your caregiver burden currently is. And we recommend that if you do take the time to go in and do this assessment, that you find some time to discuss it with a professional, whether that's your doctor or your loved one's doctor, or if you seek out some sort of therapy. It's really great to get some professional insight on top of that. But regardless of where you fall on the caregiver burden continuum, there's no better time than now to think about how you can do a better job caring for yourself. So consider if you've got all the professional support that you need, and be sure that you are tapping into your existing support systems as well. It can be helpful to explore the many different resources that may be relevant to you. So here are some of our favorites. First, of course, the Parkinson's Foundation helpline. And if you're not familiar with it, our online forum, PD Conversations, is a great way to engage with both the folks who are specialists on our helpline and other care partners and people with Parkinson's. And either way, whether you reach out to the helpline or connect through PD Conversations, these are great ways to access our resources and to get sort of a tailored recommendation based on what you're going through. AARP has some really great materials for caregivers at aarp.com/caregivers. And if you're on Facebook, you can search for their family caregiver discussion group and connect with caregivers around the country. They share lots of practical tips. It's a wonderful resource. The Elder Care Locator is a public service of the U.S. Administration on Aging, which works to connect you with services in your area. So they may help you connect with your local area agency on aging, or they can explain specific resources that are available in your location. So it's a great first place to start when you're feeling like you really need to find something local, some additional support. I definitely recommend utilizing that. And for those of you who are caring for a veteran with Parkinson's, we always recommend that you connect with the PADREX for expert Parkinson's care, or you can call the VA Caregiver Support Program to make sure that you're accessing all of the support that is available to you. And then, of course, some of my favorite Parkinson's Foundation resources for care partners. Obviously, I'm a big fan of the Care Partner program, but also I want to highlight our Caring and Coping workbook, which is filled with great worksheets and tips and ways to engage and learn. And then also our Care to Talk cards, which are designed to spark conversations about how being a family caregiver has affected you in key areas of your life. These cards are great for a family dinner. They're great at a support group. They're great, just really great ways to start the conversation about what you're dealing with, what's going well, and what you're struggling with. And then finally, I want to leave you with some wisdom featured recently on our blog about finding a counselor. So if you're ready to look for a counselor who's a good fit for you, you can start by talking to your support group and your healthcare team. You can also reach out directly to your insurance provider, although in my personal experience, this is not always the most efficient route. The area agencies on aging may be able to help you find someone, or you can reach out directly to community-based counseling agencies that you know of. There are directories online, and if you are uninsured or are looking for a low cost or free counseling service, I recommend calling 211. They offer comprehensive information about local resources and services, and they can usually just type into their database free counseling and pull up a list for you to reach out to. And if you do find a counselor that you're considering, there are some important questions to ask yourself to make sure that they're the right fit. So, do they accept your insurance if you're going to be using that? Are their hours and location convenient? Can you meet with them in person or virtually? And which do you prefer? For me, I love the virtual option, not having to worry about driving across town, going into the office, dealing with parking and traffic. I love the virtual option, but that's not right for everyone. Do they specialize in helping clients in your age group or with similar concerns? Do they know about chronic illness and caregiving? You're probably going to struggle if you look for someone who's an expert in Parkinson's. That doesn't mean you won't find them. But you can find someone who is going to understand what you're going through. And ultimately, do you get the impression that they will be affirming and competent to support you? That one is the most important. So with that, I would love to go ahead and dive into the questions. So first, what do you do when your spouse or partner resists doing what he needs to? Physical therapy, exercise, going to an appointment. The person who submitted this said, I feel like the bad guy when I'm trying to encourage these things. What does that look like for you, Marlene?
Yeah, I feel like the bad guy all the time because it's like Bill's pretty open to things, but at the same time, when I try something new, like we're going to speech tomorrow, that'll be new, and he's pretty open to it. But I think I just try to really explain why this might be a good thing, and let's just try it and let's give it. Like occupational therapy, he didn't really love that, and but you know, it helped, and they came out, it did. And so I think showing them, if you can get them to go do it, and then showing them like, well, didn't that help you a little bit? And so I think that's just it, and keep trying. It's really hard. I have Bill likes to take whatever I find, and I find these tips when on these classes and things, and calendars and reminder boards, and then Bill likes to turn them into something else. And so I bought a daily calendar, and he turned it into a weekly calendar, and that really defeated the purpose. So I just keep trying. I just keep trying. And it gets hard because, you know, I can't say that I don't get frustrated or we don't bicker about it. We do. But at the same time, I think it's like when they see that it could help them, and it does. I mean, when they see the results that it's starting to help. Or the other thing that's really good to do is if you have other friends or you go to support groups, if you start talking about it and those friends say, oh, I did that, it was great. Well, all of a sudden it's a great thing to do. So I would encourage that if you know someone who's done it, and to let them, you can just bring it up. And the other thing I forgot to mention, I have been in support groups over the years, and they really do help. And we have an informal support group of friends that we met more before the pandemic, but that really helps. And you can always, you find a couple of friends that you could even just email and vent with, and it makes all the difference. I mean, even if you're not looking for anything, just needing to vent, like send a quick little email or text, because you probably all are feeling very similar things. But other people, when they validate, oh, that's great, it works, that seems to perk him up a little bit. So.
Awesome. We got another question asking if your husband, Bill, was in denial about his abilities and how, cognition and all those things were starting to decline. And if so, what did that look like for you, and how did you overcome that?
Yeah, we're still in that a little bit. I mean, he realizes now, like with the pills and with the money, that was something he kept locking us out of the online banking. And that's when I was like, I think maybe I need to be the one to handle this. Or there was a couple of mistakes. And for someone who's an accountant to see themselves making mistakes was really, really hard. Bill always has this thing, well, I'll try better. I'll do better next time. And it's hard because, I mean, it depends, what's going on with your symptoms, but sometimes it isn't about trying harder. And so he's really come to terms with a lot of it because he's seen the mistakes and not being able to do a lot of things. But at the same time, yeah, there's things where it's like, honey, you shouldn't be doing this. And he still wants to keep trying. Like he thinks that, like, I'll be like, he has a lot of problem with dizziness, and then he still thinks he should carry all the bags and open the doors and, all the things. We've been together for over 40 years. And so I think it's just trying to just kind of like point things out. And unfortunately, some things happened. And then when something happens, like we were paying a bill for a long while that we shouldn't have been paying. And then when he noticed that, he was like, yeah, I can't do this anymore. So hopefully they get to figure it out a little bit before it happens. But those things, little bit by little bit, kind of like change their attitude. But yeah.
All right, I love this question. Do you have any strategies for practicing patience in the moment, especially when it comes to the realm of cognitive function?
Yeah, that's really hard because I can't say, I wish I could say I'm always good at this. I'm not. I think the biggest thing I'm trying to remember now is, I was pointing things out. You're doing this wrong. You're doing this wrong. And then I was like, why am I pointing this out? It's not always helpful. I mean, obviously, if it's something really wrong, but there's things he does that he's just not going to do the way he used to. And so I'm just trying to like keep that in the back of my head that if this isn't hurting anything, just let it go. And walking away helps if you can, going in the other room and being like, okay, honey, I'm going to take a little break. So that really helps too, if you can do that. But I think just sort of keeping in mind, if it's not really hurting anything, take a deep breath, and in my case, I get another cup of coffee and just kind of relax. Yeah.
I love that. Okay. So I heard managing your expectations, letting things go that don't matter, and taking a moment to yourself to collect your thoughts. I love all of those. All right, we have so many great questions coming in. We could probably talk for another hour. How have you handled changes in your marriage and your relationship caused by the progression of Parkinson's and the cognitive stuff?
Yeah, these are, this is all hard, because I've known Bill since was 17, and I'm over 60. And so it's been a long time. And one of the things that's really hard is communication, like conversations just don't flow like they used to. He has a lot of trouble figuring out those word choices, and the conversations sound different. And so those fun, casual conversations just don't seem to happen. Trying to, when you spend the whole day helping them, and then at night you're like, please, I just want to sit by myself. And then they're like, what do you want to do? And you want to go do something, want to watch something, and I'm like, I just want to sit. And I think that's okay sometimes, to say I need a break. But one of the things I've found is that trying to find something that you can do together, that either a new something like that neither one of you did before, because then you're both doing it on sort of even footing, so you're not like, oh, we're doing something that we did before, now I'd still do it like I used to, and you struggle. It's like, we're going to try pickleball, we'll see, but something like that, because neither one of us have done that. And I was never a good athlete, Bill was, but maybe we'll be a little more even now, I don't know. But something like that, or Bill still really likes sports, and so I've kind of really gotten into like football, watching with him. And so I think trying to find these connections and letting go of some of those, like you said, those expectations, like what was it. It's not that I don't feel the loss, I do. And you're constantly in this grieving moment. And I have gone for counseling on and off over the years. And, I was thinking about that again too, getting some help sometimes. So, and we even did it as a couple a number of years ago. I don't know if it would help as much now, but it did help, because everything changes. But I would say if you can find something that you can do together, that's new, that seemed to help.
I love it. Have you thought about what the future might look like as Parkinson's progresses, if the cognitive challenges get worse? Have you guys talked about that? Do you stress about that? Does that weigh in as you're, sort of assessing how you're functioning and feeling about this caregiving role?
Yeah, I mean, we are being a little bit more realistic about it now. We were so scared in the beginning. We just basically put our heads in the sand for the first few years. And I wish I wouldn't have done that. If I could say, if you're new at this, I would say, look at, finances, and if you're thinking about, if your spouse is still working. And we waited too long. I mean, it was okay, but it caused a lot of more stress than it needed to. So we've looked at that. We've looked at possibly moving by our children who live out of state. That will probably happen. I don't know when, because Bill's mom's still here and we have some family here, but that's one strategy. I have thought about it a lot, because we watched Bill's dad. Bill's dad had the Parkinson's psychosis, and we watched that at the end. And I know that was it got pretty scary. And he ended up passing away pretty quickly. it wasn't what we thought would happen, but it did. And so we've seen a little bit of that, not saying that that will happen, but so we're looking ahead, and it's hard because we're early 60s and not sure if what's the right next move. But we have thought about it, and I try not to stress about it too much, but the closer it sort of becomes, actually, the less scary it is, because I know I have to start facing it more. The early days are hard because you're so scared. You really are.
I think that's a really helpful insight, that it's almost, it can be scarier in the beginning when you don't have any idea what's to come. I wouldn't have guessed that you would feel better about managing it as it got closer. So I'm glad you shared that. Have you connected with any professional supports that have helped with coordinating care or navigating those questions around long-term care and financial planning and all of that you would recommend that people connect with if they're able?
We haven't used like formal social worker, except from when Bill was in the hospital. We have a financial person that has helped us, and we did see a lawyer and got, like, you know, power of attorney and things like that set. And I know, like, Parkinson's Foundation, I think I've gotten a lot of information from Parkinson's Foundation on planning, and I think you all have some brochures or booklets or you know, on planning for the future that way, and legal, and where to go for things like that. We have talked about it quite a bit, and like I said, I've taken over a lot of, we either do it together or have taken it over. We do things together because I'm trying to keep him in the loop as much as possible, and trying to let him still have a role, but it's been hard. As far as care in the home, I have somebody help clean, and we haven't had to have anybody like coming in to like sit or anything like that right now, other than like informally with friends. But you know, just keeping up the doctor and the nurse practitioner at the doctor, and he has a movement disorder specialist, and it's hard because every time you add another person, there's more on your plate. So you're trying to navigate it. But I know there's a lot of, we have called the helpline, and look, you know, over the years, I think about it now, it's not that it's been that long, but it's been that long. And so I guess I've tried almost everything, but trying to get information. Bill's very active with Parkinson's Foundation, and we like always do moving day, and you find a lot of information. We try to go to as many of these kind of online courses and conferences and things to get as much information as possible.
Awesome. Well, I am going to hand it back over to Kim. Thank you, Marlene, so much for all of the insight. This has been such a wonderful conversation, and
I just want to echo that, and I think you know, those takeaways are just incredibly valuable. So I did have a couple of things that I saw come through the questions that I wanted to respond to. One is, we saw a consistent question around maybe extended family, adult kids, like maybe not fully understanding Parkinson's or the progression of it and what that means to the need for support. Please know you can always reach out to our helpline. We get that question very frequently, and I think our experts on the helpline, our specialists, are very good with that. But also, it's a few months out, but in August, we're going to do a whole Wellness Wednesday focused on that. So we'll be talking about how to engage adult children and family members and helping build your support system around that. Because, you know, as we've heard today, you can't do this alone, and we'll explore some strategies for that. So with that, I do want to thank, deeply thank Annie Brookes, Marlene Perdan, and of course, all of you for joining us. We do highly value your feedback. Gosh, this was such an interactive group today. Loved seeing, you know, the comments and the tips that were coming through through the chat. And we definitely welcome your feedback with regard to the program itself. Watch for a survey to pop up at the end of the program. You'll also receive a link to it in a follow-up email. I want to note, I know Marlene talked about our PD Health at Home programs. These take place each week. They are free, they are online and accessible. They're also recorded. So check out our Mindfulness Mondays, our other Wellness Wednesdays that include things like socialization for your person living with Parkinson's. And then Fitness Fridays are really just tremendous, a great variety of free online workouts that are all really highly focused on the person with Parkinson's and their care partner. Next, I'll just remind you, if you had a question that wasn't answered today, do reach out to our helpline, 1-800-4PD-INFO, or you'll see the email address there, helpline@parkinson.org. And next, we want to just welcome everybody to stay on while Annie is going to walk us through the care partner training that she talked about, building a care partnership. So if you want to just hang on here for the next few minutes, we'll keep the chat open. You can share any questions you may have. And Annie, go ahead and start us on our little tutorial here.
Awesome. All right, so I'm going to share my screen again. And here is what you'll see when you put parkinson.org/care partner program into your browser. So what you're going to do is hit this login. And as you can see, I'm already logged in, but I'm going to create a new demo account so you can see exactly what to expect. So I'll do test@test.org. I will, it actually would be helpful if I scroll down because I'm creating a new account. So you're going to click this create new account. This is where I will then say test@test.org, test. And then I'll create my password and click sign up. Oh, so many pop-ups. Okay. So this is not showing up how it's supposed to. And if it does this to you, you just put that care partner program in again. So we are signed in, and you'll know because you'll see your name up here at the top. And that's where, all right, there we go. So this is my dashboard. This is where it'll take you every time you log in. And when you register at parkinson.org/care partner program, it signs you up for all of the English courses. And we don't expect you to participate in all of them, although you're welcome to. And you can just take a look through, and the one that we always recommend you start with is the welcome. Talks you through what you need to know. There's a little message where you'll see my face again. And then we have a little survey that helps us better understand who's participating in the program, and then a little bit about what to do if you have any technical issues. That's the whole welcome course. And you'll go through, and if you want to start with the burnout course, you'll click start course, and then it opens up. So as you can see, we've got some information here about what to expect. The burnout course we expect will take about an hour and a half to complete, whether you sit down and complete it all at once or if you spread it out in little chunks. Talks about the course content, etc. And then if you take a look, it's broken up into chapters. So within every chapter, you're typically going to have a video featuring Lance, who you saw in some of the earlier clips. And then you'll have an opportunity to engage with other resources. Sometimes here we've got tips from within the Caring and Coping workbook. And then each chapter has an opportunity to pause and reflect. So you'll go through all of these until you get to the end, where we'll just ask you to do a little survey and let us know what you thought. And that's what it looks like to participate in one of these courses. And you can, like I said, check out as many of these as you're interested in. You can go back and utilize them once you've completed them. We do periodic updates. We just updated the Caregiver Burnout course, so it's even more user-friendly than it was before. So yeah, does anyone have any questions about going in and getting signed up for the course? Is anybody having any trouble? Let's see.
Yeah, Annie, I haven't seen any questions in the chat or the Q&A specific to the course.
Well, I'm going to take that as a good sign that I made it look really easy. I hope that you guys are going in, and if you're not already registered, I'm going to go ahead and do that. This course is totally free. It is available all hours. We know that sometimes I hear from our folks with Parkinson's that the best time for them to go through different courses and program recordings is when they're up in the middle of the night and can't get back to sleep. I hope that's not true for too many of you, but it is available at any time.
Let's see. So we shared the website again of where to get signed up for it. So yeah, I don't see any other questions. Yeah, I think this is great. I thank you, Julia, who said she had signed up previously, and now maybe it feels like the right time to work on the course. So that's a great note to end on, and we hope that everyone will check it out, take that time for you, and know that you've got a whole community that surrounds you and excuse me, supports you. And at any time, just reach out to our helpline, if you're not getting what you need and have questions. So thanks again for being here, and we hope to see you on another program soon. Take care.